Hello everyone and welcome to NEET Mentor. So finally, the gadget of next is published by NMC. So this is and you can find the gadget on NMC website. Okay. In this video, we are going to talk completely about what the gadget says, and it will clarify many queries. What queries you might have? You might have the queries whether there is negative marking. The pattern of the examination we already know, which is again mentioned here. How the exams would decide the rank, okay, and for how many years it will be valid, okay, who will take which exam, and what about FMG, okay, those who are final year MBBS candidates, what exam they need to take for their internship, okay, and those who already have completed internship, they have medical registration, what exam they need to take, okay, in case you fail in one of 6 papers, then what is the option, okay, and how many times you can take the examination next one, and what is the purpose of next one and next two, okay. So many things are already clear, okay. Some points which was not clear out in the webinar, they have cleared in this one, okay. So let's go one by one throughout this gadget. When I say it's gadget, is already implemented, it's not proposal, okay. So chapter 1, chapter 2, chapter 3, they have mentioned like that. So this part is just for definition, and here we go. Commission or appropriate body or authority institutes as approved by commission shall conduct the next exam as just specified under here. So they have already mentioned EMS is going to conduct, and they have published the brochure also for the mock test, okay. So the next exam will certify the eligibility of medical graduate to register to practice under the modern system of medicine, okay. It will also determine the eligibility and the ranking for the purpose of admission into the PG courses, okay. So it will the next exam will give you two permissions. One, they will allow you to get admission into PG course. Second thing, they will certify you to get registered with medical registration to practice medicine in India, okay. The following shall undertake, okay, all these points you already know, okay. I'll come to the point, chapter number 2, okay. Next, step 1 will be a theory exam, everybody knows it. Questions shall be one or more than one type of MCQ, okay. Examination shall be conducted in CBT, computer based online mode, okay. The demo will be conducted on 28th of July, okay. You will come to know how it will happen. And there are 6 papers: medicine and applied disciplines, surgery and applied disciplines, obs and gynae, pediatrics, ENT and opthal, okay. All those students who have completed their third year MBBS and final MBBS course from a medical college approved by NMC, okay, are eligible to appear in the examination, okay. There shall be a regular next one examination will be held twice. It was also clarified in the webinar, okay. It will be held twice in a year, in month of May and November, or any other time as mentioned by the commission. There is no restriction to the number of attempts. Very important point. There is no restriction to the number of attempts to appear in next step 1, provided the candidate has passed both next step 1 and next step 2 examination within 10 years of joining MBBS course, okay. You join the MBBS course means you get admission into the college, MBBS college, and from there 10 years means 5.5 years you do MBBS theory course, and then your time starts. There is no restriction to the number of attempts to appear in next step 1 examination to improve. So you can improve your score, like you attend NEET PG 2022, you didn't get good score, then you, for improving up score, you wait 1 year. But here you don't need to wait for 1 year. You can improve the score in next 6 months, So there is no limitation on the number of attempt to improve the score, provided these examination for improvement of a score are taken after completion of next two. So once you complete next two, okay, you are entitled to appear in next one for improvement of a score. Okay, if you don't complete next two, then you can't attend next one again to improve the score. So you complete next one, you qualify in all the subjects, then only you can attend next two. Once you attended completed next two, then you can go for next one in number of times. Now, one more doubt. The next one, the next step one shall replace the conventional university theory, institutional theory examination of final year. Okay, so it will replace the final year exam. Now, is it mandatory to give next step 2? So here is the answer. Next step 2 shall be a practical clinical viva based examination covering these 7 clinical subjects. Okay, it was also mentioned earlier. Examination will be objective structured clinical based simulated cases, patient aimed evaluation, practice, clinical skills, clinical decision making, communication skills, okay, expected of an Indian medical graduate. So it will be a practical examination. So there is no marks, either either pass or fail. The examination will be held in a person or shall be conducted by the respective state health university institution following the standard guidelines. The commission shall decide the university institution to conduct a next step 2 for the respective colleges. Okay, there shall be a regular next step 2 examination twice a year. So in case you fail in first attempt, you go for next attempt. Okay, so they will make a proper doctor out of you. Then only they will allow you to register with medical registration, and then you can go for multiple times next step 1 examination to improve the score, and then go for PG admission. Next step 2 supplementary examination shall be held twice a year and is restricted to only those candidates who have failed in one or more of the 7 subjects are required to repeat the subject. If candidate fails in more than 3 subjects out of 7 subjects, if you fail in more than 3 subjects, you must appear in all the 7 subjects afresh. Hence you are considered below standard and you have to give all the subjects again because they find you doubtful about other subjects also. There is no restriction to the number of attempts to appear in next 2, provided the candidate has passed next step 1, next step 2 examination within 10 years. Okay. Now nature of scoring, which is more important. Okay, how you will score, and is more important for the candidates for PG admission. The marks in next step 1 shall be calculated as whole number, which shall serve the raw scores with appropriate decimals and subsequently a percentage out of maximum 100. Okay, next step 2 exam result will be declared only pass fail. So there is no role of next step 2 in calculating your rank. Okay, minimum score to pass. So there are 6 subjects. Minimum marks to pass will be 50% out of 100 and half of maximum possible raw score. Okay, so 50% you need minimum, which is same as FMG rules. For next step 1, in each of 6 paper, a minimum 50% is required to pass. For the calculation of above scores, next step 1 cycle will be considered. Okay, they have given 2 examples. Suppose a candidate scored minimum passing 50% in 2 subjects but failed in rest of 4 subjects. So she can appear in next exam cycle, which is getting conducted after 6 months. Okay, in the next one, in the next cycle, if he or she scored minimum passing marks in the rest 4 subjects, then she will be considered to have fulfilled the above criteria, means your next one is cleared now. Okay, in case candidate scored passed in 2 subjects and failed in 4 subjects, then he or she can appear in step 1 next time, and if she or he passes 2 subjects, and then he or she can appear in the next, means third cycle. First 2 subject passed, in the next cycle 2 subject again passed and failed in 2 subjects, then she can appear in the third cycle for the next 2, okay, failed subject. and if you score in the remaining two subjects, then you will be considered you have fulfilled the criteria. Okay, so you have to just pass the subjects which you failed. Okay, now more important point for the PG admission, how the scores will be calculated out of next step one uh, exam. For the purpose of determining the merit for admission into broad specialty postgraduate course, it will be calculated from the sum of raw scores obtained in each and every paper. So you will have to perform good and well in all the papers. So all have equal weightage. So no subject is more important and no subject is less important. They have equal weightage. You will get the aggregated score. Okay, that's why next it is difficult, because it may be possible that in the first attempt you don't clear all the subjects. Okay, so you have to go for the exam in the next 6 months, but you have to prepare for the remaining subject. That's the best part. Okay, so that you can focus and you can get good score in each exam. Okay, uh, so for determining the merit of for the admission into PG courses, admission counseling, the next step one score shall remain valid for 5 years. Your score will be remaining valid for 5 years. Suppose you give exam and then you want to continue with your job, and then you want to take admission after 2 years, it's still valid. Okay, however, if candidate is appeared in next exam cycle, and then the previous your score would be invalid, so your latest score will be for a particular subject will be valid. Okay, means you want to improve. In case it happens like last year in particular subject you have got uh, better mark, but this year lesser mark, then you are uh, your overall merit will degrade. Okay, so you need to improve to what, if you are attending again means you are improving, so your latest score will be valid. Okay, so only last attempt next to step one score will be considered. Point number third, determining rank for admission to PG course. Okay, the candidate need to apply generation of a rank. So you have the option when you want to apply, when you want the commission to get your rank. Okay, so you need to apply generation of rank in a manner as prescribed by commission time to time. Okay, they will give you option that you want to apply, you have clear all the exams, and you suppose or assume that this is the best score that you can get, then you can apply for is something like GRE exam for admission into like management courses. Okay, that's very old story. They have to do multiple attempts to base on the base score, they will take the admission. So you need to generate your ranking, and once only those candidates who have applied for the generation of mark will be entitled for the admission into the academic side. So for one academic year there will one counseling and you need to apply for generation of rank. Okay, tiebreaker rules, they have mentioned that okay, lower number of attempts will be given higher marks. The candidate with higher marks in this following order will be given more preference. So all such things. Okay, now I hope you are clear that how the score will be calculated. Okay, that's why it's more tough. Okay, but there are benefits also. Utilities of next score, eligibility of for the registration, provisional registration to pursue internship as a governed by the means if you want to do the internship, then what you need to do, you need to pass in each 6 theory paper of next one. Okay, and you need to pass in the your university final year exam, then you can go for internship. It was also clarified the sequence. First you complete next step one, then you write your university exam, then you go for internship, then the next step two. And now coming to eligibility for a foreign medical graduate for the provisional registration to pursue internship as a governed by uh, NMC. Okay, so for FMG candidate, okay, they need to pass in each 6 theory paper, and then they can go for. So it's the same for Indian graduate and foreign graduate, that we have been talking that now after implementation of next is going to be one and the same. Eligibility to grant a license to practice in the modern system of medicine in India. Okay, So for that you have to uh, you should have passed means you should have fulfilled next step 1 and then internship, okay, and then you should have passed next step 2, okay, and then fulfillment of requirement as per the registration. You fulfill the requirement and then you get it. Means first next step 1, then your final year exam, then internship, after internship next step 2, after next step 2 you will get the license. You need to fulfill the requirement and apply it. You will get the license and then you can go ahead with the NEET PG, PG admission. It won't be NEET PG, it will be PG admission or some other keyword. So eligibility for admission into postgraduate, okay. So for that you should be eligible or you should have the license, okay, already. Then only you are eligible and has participated in the manner of common counseling. So common counseling is going to get conducted. I means it will be the counseling will be in the pattern of common counseling as prescribed by the NMC. So they have given example here as well, okay. So what is the example? All those who have granted a license to practice, okay, and register in the NMC or state medical registration before the commencement of the regulation and wish to take admission in postgraduate courses in broad specialties need to appear in the next step only. So those who have already been granted license to practice, they don't need to take step 2. Step 2 is just to give you license or registration, okay. Once you had the registration, you don't need to think about step 2. You need to attend next step 1 exam, okay. So that's all the important point I wanted to cover in this video. The video, okay, it has some other things like which was already mentioned. Now there are a few questions, the pattern and all, must to know how many percentage and all these things, okay. So and these all things were mentioned already in that webinar, okay. The timing, okay, and distribution of subject, time schedule, when is the tentative exam date. So next step 1 final year exam, then you do internship, then next step 2 will do supplementary, and then you do medical registration and then go for postgraduate admission. The counseling will be happening once, but you can write the exam 2 times to improve the score, okay, and later will be considered. Now few questions, whether it has negative marking. It was nowhere mentioned in this gadget, but in the mock test brochure which was published by AIMS Delhi, it was clearly mentioned that 1 mark will be granted, okay, for every correct answer, and 1 by 4 marks will be -1 by 4 marks will be granted for every incorrect, okay. So it means there is negative marking and there is no MCQ exam. The beauty of MCQ exam to test the ability of the candidates or their caliber is only justifiable if there is negative marking. Otherwise guesswork will be more, okay. So hope it was useful, and if you have any query, you can put us the query in the comment section of the video. We will take it one by one and we'll try to create more sophisticated video with all the queries in the upcoming video. Thanks for watching. Have a nice day.